Good evening, everybody, and thank you so much for joining me again tonight for another Instagram Live. When I sort of started doing lives on Instagram, I wanted to make sure that I was covering a range of topics that are of great use and importance to a lot of different people. And a lot of these are topics that are hard for people to talk about. Some of them can be very hard to hear about, but I don't want to avoid topics simply because of this reason. And tonight I am going to do a live that focuses on sort of an area that is particularly hard for a lot of people to discuss, and that is miscarriage. Now tonight I was going to be joined by Samantha Payne, who's the CEO and co-founder of the Pink Elephant Support Network. Unfortunately, she's not able to join me tonight, but she's going to be filled in by the wonderful Anna Cratterville, who is the peer support manager at the Pink Elephant Support Network. And I'm going to let Anna tell us a little bit about more about what the Pink Elephant Support Network is, what an important role they play, and tonight we're going to cover sort of all the different questions that you might have around the area of miscarriage and early pregnancy loss. So I'm going to get Anna to join me now. I think this is Anna's first live on Instagram. Grateful that she's joining us this evening. She's joining me at the moment. Hopefully won't be long. Sorry about the delay. If I don't have any luck, I'll cancel Anna's request and invite her to join us. Not there. Hold on, let me try again. Sorry about this technical issue. Here we go. Hello.
Okay, I'm so sorry.
Oh, Anna, not a problem at all. Thank you so much for joining me tonight. I really appreciate you standing in for Sam at short notice. It means a lot, and I know there are so many people who are really looking forward to tonight, and I am really, really grateful, as I said, that you're helping me out with this really important discussion and chat this evening.
Oh, well, thank you so much for having me, and I'm sorry Sam couldn't be here, but she is currently trying to process her third miscarriage that she's just had. So
absolutely, and definitely, I think it's such an incredibly difficult thing to go through once, and tonight, part of our discussion will focus on, recurrent miscarriage even, but, my thoughts with Sam and her family at this point in time, and please send her my best wishes personally, and I'm sure, sort of the regards from everyone that's watching this evening.
Will do, thank you. Appreciate it.
Thanks, Anna. So what I wouldn't mind starting off with this evening is you telling everyone watching a little bit about who you are and how you came to the Pink Elephant Support Network and what they actually do. I think the timing of this chat is perfect. October is Pregnancy Loss Awareness Month, and being the first day of October, I think this is a really appropriate and important discussion to have this evening. But I think if you can just tell us a little bit about your background, if you're happy to share that with us, that will, I think, a lot of people watching tonight feel, reassured and heartened that they're listening to someone who understands.
Yeah, of course. No, happy to. So I was busy doing a very different career a while back. I had my son, all smoothly, swimmingly, no worries, nothing. And then I got pregnant again with my second. Everything was going fine. I actually had my 12-week scan. Everything was fine again. Everything was going hunky-dory. And then, so I had something quite unusual happen. So about 15 weeks, I started spotting, but it was more a case of sort of passing clots, as opposed to actually bleeding so much, if that makes sense. So I went to get scans. They couldn't see a problem. Baby was fine. Everything was fine. I kept going back every week. So I stopped going to work. I kept going back every week. And then by the 19th week, they realized that what had happened, and basically my amniotic sac had got a hole in it, and it was leaking the amniotic fluid. And they didn't know how or why, but it got to the point where there was not enough room for the baby to grow, and it was too early to survive outside. So so I had to have what we call a termination for medical reasons. So at 19 weeks, 5 days, I gave birth to our second son, Alfie. And then...
Beautiful name.
Thank you. And then just discovered this whole world of a club you never want to be in. But also interestingly found that I was just under the umbrella of miscarriage, which is what everyone refers to as losing a baby under 20 weeks. And then when you're over 20 weeks, it's a stillborn. And we were on the 19 week, 5 days. So we were just under. And it was so interesting, the difference between not how you get treated, because we did get a social worker, but in the sense that you don't get a birth certificate, you don't have to do all these things. The hospital can take your baby and dispose of your baby, but if it was 2 days later, you have to do it yourself. There's a lot of issues with that. And I also, so we got given a social worker, but it was one of those ones where you weren't comfortable on the miscarriage side of it, but then we weren't comfortable on the stillborn side of it. It was one of these interesting. But at the same day, so just before I gave birth to Alfie, I got made redundant with my work.
Gosh,
So that was a great day. And it was a bit mind blowing. And it was also, so I used to work in magazines, in media. And it's a declining industry, and it's something that was always going to happen. But it I ended up grieving both my career and my baby, and what am I going to do for the rest of my life, and everything else. We then we waited 6 months, which actually worked with my grief and having a 2-year-old and everything. And then we got an all clear sign, and after 6 months, and so we could try again. And then we did, and we got pregnant straight away, and we now have twin girls.
Oh, wow. Busy times in your house, that's for sure. How old are your girls now?
Yeah, it is. It's a bit mad. But so it's a different sort of story. But then about 18 months, 2 years later, well, not even that actually, I was part of a sort of a community Facebook group in the area I lived in Sydney, and two local women had started a miscarriage charity. And I had been wondering what to do with my career. And funny enough, one half of me was thinking to become a midwife, and the other side of me was thinking about becoming a counsellor. So I thought, well, why don't I see what's going on with this miscarriage charity? This is something I would have appreciated when I, was going through it. And they're local women, and we can, meet up and get together. And I ended up applying to be a peer sport. So that I could try out a little bit of the counselling sort of stuff and see how it went. So that's how I came across it. So I ended up being in a group there was 4 of us who got trained, our first little training by a counsellor, social worker, actually another 2 more counsellors actually, to be a peer support ambassador. And then having done all that and having got the girls sort of through the baby stage, I then decided that's what I actually really want to do. So now I am studying a double degree of psychology and counselling.
Oh, fantastic. Well done.
To go on to do that while I'm also working at Pink Elephants.
Absolutely brilliant. Really, really wonderful. Firstly, thank you for sharing your very difficult story. And as I say, it's probably never easy to talk about, and something you obviously never forget, but something a lot of people will really, I think, benefit from hearing. So thank you for sharing that. I'm really grateful tonight. So within sort of Pink Elephant Support Network, you've sort of told us a little bit about your role at peer support manager, but what is the network? What do they do, and sort of where do you fit in the whole scheme of things?
Yeah, well, we are a not-for-profit charity, and we are basically there to provide information and support for everyone going through a miscarriage and early pregnancy loss. So that includes the later miscarriages as well. We include everyone. We just found that a few of the other charities didn't concentrate on the sort of under 12-week miscarriages, which are most common, which are the 1 in 4 pregnancies, which are the 282 women a day who miscarry.
Absolutely. Yeah.
And no one was really concentrating on them, and no one was really sort of allowing them to grieve and provide support. So we concentrate a lot on early miscarriage.
Fantastic.
And basically provide information, because a lot of the time we find that people get told this is what's happening, there's nothing we can do, go home. And people are just left lost or Googling or doing all the wrong things. So we're there to provide sort of information, but also mainly support as well for everyone who are grieving and they don't realise that they're grieving, or they're just in shock. We call numb and stunned stage of being told what's happening and not knowing how to process.
Absolutely. And I think you make a very good point. I think there are far more established processes for women and couples that, you know, unfortunately lose babies later in pregnancies. But for the cohort, and it is the much more common time to, you know, experience a pregnancy loss in that first trimester, there is much less a sort of rigid follow-up or sort of care system that allows these women and couples to be looked after. And I think that they often do sort of, you know, fall by the wayside because the system just isn't as well structured. And I think it's great that you are here to look after women that lose a pregnancy at any stage, because the impact can be just devastating for, you know, women and couples who don't go into a pregnancy thinking about a miscarriage or expecting a pregnancy loss. I think for most people it comes as a complete shock. It really blindsides people. And I think when it happens, it's really important that they know where they can go. So I'm going to sort of take a step back now and sort of start with what is an early pregnancy loss. And obviously this is something I talk to patients about every day. You know, this week alone, I'm looking after 5 women who are in the process of having a first trimester miscarriage. It is very common. And I know you said approximately 1 in 4 pregnancies, and that's the same number that I quote to sort of my patients. But what is a miscarriage? How do you counsel women and couples who come to seek your guidance about what's happened? What is a miscarriage? Why does it happen? When does it tend to occur?
Well, so a miscarriage is basically when a woman loses a baby, but it can come through in many different forms. So we counsel them obviously through all the different types. There is one that is sort of not a lighter one, but a very early one, which is called a chemical pregnancy, which is when you actually just have a slightly later and heavier period, and that's but it's still counted as miscarriage.
Absolutely.
And it's still relevant and valid.
I agree.
And then we have the first trimester miscarriages, which is pretty much when your body, as far as we know, because we don't really ultimately know why we have miscarriages, but we get our bodies basically, we think, know that there's something wrong, know that there is something that's not right chromosomally or whatever it is. And so the body then goes through the process of saying, right, this baby's not going to happen. And so with the first trimester miscarriages, you can have a spontaneous miscarriage, which is basically the body's natural way of getting rid of the baby. You can have a missed miscarriage, or sometimes known as a silent miscarriage, which is when you don't know that there's anything wrong, and you go to a scan, and then they tell you those dreadful words of there is no heartbeat, which is tough, especially during COVID, when partners are not allowed in the sonography.
Absolutely. It's really, really difficult.
And you're by yourself. It's awful. And then there's an incomplete miscarriage, which is when your body tries to expel a baby, but there are some bits left in, and you have to go and have a D&C, which is again a surgical operation, which you often have to do again alone during COVID.
Extremely difficult.
There's a lot of issues that are coming up during COVID for these poor women who are going through.
Absolutely. really difficult. I must say, in the hospital where I have my practice, they've been absolutely wonderful and very much allowing partners to join women who've had miscarriages on the day of a QRED or medical management of a miscarriage, because, you know, I think we need to recognise what a huge day that is for any woman or couple going through a miscarriage, and having the support of someone there with you, I think, is really critical. But you're right, COVID has disallowed a lot of that in a number of places, and it's really amplified that sort of feeling of loneliness and isolation that a lot of women really go through. But, you know, the other thing that I think is a great point that you make is that not all miscarriages present with bleeding and pain. And I think whilst a lot of women do experience those symptoms, there are a huge number who, you know, it is so unexpected. They come for a routine scan, everything's been going well, and as you say, it's the most awful job in the world, having to say to someone that there's no heartbeat and that they've had a miscarriage. But you know, it just comes sometimes without any preparation or warning whatsoever, and I think that's what can be so difficult, really hard about that miscarriage cohort, because they don't have time to process anything beforehand or to prepare themselves. It just comes completely out of the blue, and I think that's a really difficult thing for people to go through. And I think what a lot of people ask, and this is what I'd really like to hear what you have to say as part of our discussion tonight, is the first thing that happens when I say to, you know, a woman, unfortunately there's no heartbeat there, the first thing they say is, what have I done wrong? It seems to be sort of the most common reaction or response. What could I have done differently? Is this my fault? And I'm sure that's a question that you get a lot. How do you address that question when it's asked to you?
It's probably the most common question we get asked.
Agreed.
And I mean, straight out, we'll say it's absolutely not anyone's fault. There is nothing anyone's done. It is not the exercise. It's not the heavy box you just picked up. It's none of those things that you just did. And that is just your way of processing what's happened. You're trying to understand something that's not understandable at all. You're trying to find reason, you're trying to find logic in what's happened, and it's completely natural to think all these things and to question things. And it's just part of what we see as part of the grieving process of trying to actually find out. And your blame and your self-blame, it's something I've done, because there is no answer, because a lot of the time we find no answers. So the answer must be me.
Definitely.
So it is that consistent just picking of something, and it's also a part of control, I find. Correct. I agree with that. A lot of people have a lot of issues with just losing control, especially with a miscarriage, because their body deceived them. It didn't tell them that there was something wrong, and that lack of control with their body and what's happened is a huge issue, which they then try and find answers for, and sometimes there are just not any answers. It's just
exactly. And as you say, often we don't find an answer, but I usually say to women or couples that I look after who had a miscarriage that about 70 to 80% of miscarriages occur because of a chromosomal abnormality in the pregnancy. And I always explain to them that that is not something they're passing on. It's just something that's occurring sort of sporadically within the genetic material of the pregnancy. It's nothing they're more likely to pass on in a future pregnancy. It's not more likely to recur, but, you know, it's not their fault. And I'm very clear about that. I always say exactly what you've said. It's not because you've done a particular sort of exercise or had sex or eaten anything. It's just something that has unfortunately happened. And like you said, it's sort of your body's way of telling you that this probably wasn't going to be a healthy pregnancy anyway. But everything you're sort of saying is what I share with my patients as well, because I think, you know, they instinctively try to blame themselves for what's happened, which is a really, you know, obviously a devastating thing to think, but really, really challenging.
And that's why we need to give support, because of that.
Absolutely.
Sorry.
No worries. So that's... Definitely. Now, Anna, as we mentioned before, about sort of 25% of clinically recognised pregnancies will miscarry. Some couples or some women are unfortunate in that they go through more than one miscarriage. And I have a particular interest in looking after women and couples who've had recurrent miscarriage. Do you see a lot of couples and support a lot of couples who've had more than one consecutive miscarriage through your group?
We do. Yeah, we do. And we have a bit of information on that on our website as well about recurrent miscarriage. Because it's a shock, because you think it's only going to happen once, or it's
absolutely.
only common that 1 in 4 pregnancies, therefore I won't have it again.
Yeah.
And it's the shock of finding out that, hang on, this has happened again, why me? So we get a lot of people with that and the questions and the guilt again. But we find that after the medical team have now, I suppose the world have opened up to doing more testing now, which is fantastic.
Absolutely.
Yeah.
And I endorse that completely. You know, when I started obstetrics years ago, there was a lot of discussion about, you know, only investigating women who've had 3 or more consecutive miscarriages. And I think, you know, the medical sort of fraternity have become a lot more considerate of women and couples going through things, and said, why should we wait until this has happened 3 times before we start to look into it? And I certainly now perform additional investigations in any woman or couple who has had or who have had 2 or more consecutive miscarriages, because I think that a lot of them are straightforward and non-invasive, and couples would much rather have them done after a 2nd miscarriage than potentially wait for a 3rd one. Now, the incidence is obviously very small. I tell my patients only about 2% of couples are unlucky enough to have 2 consecutive miscarriages, and only, you know, well, less than 1% will have it happen 3 times in a row. But for all of these couples that have had 2 successive miscarriages, they always want, you know, tests done to look for, you know, causes like antiphospholipid syndrome, thyroid disease, you know, genetic abnormalities within the parents, and it's very straightforward for us to do that. So I now, as I say, offer it to any couple or any woman that's had 2 or more consecutive miscarriages. That's all right, and I think that people find that quite useful.
Yeah, I think that's fantastic. Sorry, they're actually listening and recognizing that this actually affects everyone's mental health if it's not sort of treated earlier.
Absolutely.
And it's
definitely
important.
Very, very significant, my friend. And I know that having sort of read about your network and having chatted with Sam previously, that it's not just about early miscarriage, it's sort of early pregnancy loss that Pink Elephants is really great at supporting. So for our viewers tonight and people who watch this video subsequently, what other sorts of pregnancy losses occur in the 1st trimester that Pink Elephants is able to support them with?
We support all of the early pregnancy losses. So that includes, blighted ovum, which is also often before 12-week miscarriage, but also ectopic pregnancies that occur, and molar pregnancies, which again are complete or partial, and also termination for medical reasons. So all of those different types, it doesn't matter what type you've had, you know, you can join our support groups, which we have. We also have the downloadable resources on the website that can help with each one, especially with the termination for medical reasons, because that comes obviously with a lot of guilt and self-blame about that. And that being a choice that you have to make, that's not really a choice, so that comes with a whole other kettle of fish. But we also have the private groups on the website that you can then join to talk and share your story and connect with others who are going through the similar miscarriages. But we cover them all, we support them all.
Wonderful.
Whichever one you've had, it's
brilliant,
all important, and we all sort of encompass them all.
Absolutely fantastic, and I think that that's so important because, you know, I think regardless of what type of early pregnancy loss it is, from the moment you know, wee on a stick and you see those 2 lines there, that excitement and joy and hope that you feel, you know, regardless of which unfortunate outcome it sort of meets, is equally, you know, sad and devastating. So I think it's really great that your network recognises not only miscarriage but other forms of early pregnancy loss as well.
Yeah, it is important, and we want to incorporate everyone in that, and it's not, we don't stop the line at 20 weeks like the name miscarriage does. We want to just to involve everyone that we can.
Fantastic.
So sorry, my phone is being crazy tonight.
Oh, not a problem at all. That's okay.
And it's just important. We just want to support everyone who's going through pregnancy loss. So
Fantastic.
It doesn't matter how early it is. That was your baby. You loved that baby. You had hopes and dreams for that baby. So it doesn't matter how many gestation how long gestation it was. It's a baby. It was your baby.
Wonderful. Thank you. I think that's so important. And I want to ask you, I'm going to come to in a minute, sort of exactly what sort of support it is that you offer women. But before I do that, I want to ask you, based on your experience, why do you think miscarriage is something that people find so hard to talk about? You know, often have women and couples that I look after, and they say, when can I tell people I'm pregnant? And, you know, it's been traditional that people only ever, you know, reveal their pregnancies after they've had, you know, their 13-week scan and low-risk aneuploidy screening if they choose to have it. And, you know, they're through that highest risk period of miscarriage. Although, as you've said, and you know, based on your personal experience, obviously it can still occur later gestations. But why don't people, you know, want to talk about the possibility of miscarriage? What is it about it that is considered so private?
So we believe that it actually goes back to before medicine became as it is now, and you didn't have scans for a while, so you didn't necessarily know you were pregnant back in the day. We couldn't pee on sticks, we couldn't know so early, and you didn't have the scans, so you didn't actually know until a lot later, and that seems to have stuck in society since then. And one of our massive missions and aims is to write the story of pregnancy loss, and part of that is that going to smash the stigma of the 12-week rule, not talking about it, and open it up to every single person themselves. So it's their choice. They can tell everyone, they can tell a few people, they can tell no one. It's completely up to you. It shouldn't be societal taboo. It shouldn't be all these things. It should be open to what you want to do. And if you want to tell close friends and family who, if you then lose your baby, they will be able to support you, then do. So it's opening that up to basically to do
exactly what I say.
If you don't want to tell anyone, that's also fine. But if you want to tell everyone or just a few people, that's great too. So there's no, you know, don't tell me in case you lose it. It's not your fault if you miscarry. It's not your fault if you lose your baby. Therefore, you're not going to get shame and anything. You're just going to get support. And that's
100% agree. Yes. Definitely. And that's exactly what I say. I say to, you know, patients who ask me, when can I tell people? I say, if you have a miscarriage and you're going to want the support of your loved ones around you and you're planning on telling them anyway, tell them whenever you want. Tell them now, because that way you've got, you know, your own, you know, support network around you. So exactly what you have said tonight is exactly how I frame it for my own patients. So, yeah, and I echo that absolutely completely. So, for women and couples who go through an early pregnancy loss, what are the main sort of emotions and feelings that they subsequently experience? And, you know, this is something that probably comes to you a lot, but what, you know, for people watching tonight who might not be pregnant yet and, you know, now have an awareness of miscarriage, and for those 25% who will be devastatingly, you know, unlucky enough to go through it, how can they expect to sort of feel? And I'm sure it's different for everybody, but, you know, how do you sort of counsel women about how they might feel afterwards?
It's sort of pre-warning them, I suppose, about the grieving process. So it's that first, the numbed and stunned stage of first being told and that process and all that. And then you basically go through the stages. So you go, you know, you go through anger is a big one. You know, why did this happen to me? Why did this not happen to the person you know who didn't want to get pregnant or whatever it is? Blame other things. There's a lot of jealousy, which is all natural. There's, you know, a lot of regret or uncertainty or confusion or despair and depression. And there's lots of emotions. And again, as you say, everyone's different, but they're all natural because they're part of the grieving process. And that's what we help people to kind of recognize and actually also validate all their feelings, but also own their grief, because a lot of people don't think that they can grieve because well, it was only a certain amount of weeks or whatever it is. But of course, this was your baby. And, you know, as we say, you love that baby as soon as you saw those lines on the pregnancy
100% agree.
So you have every right to grieve. This is your baby. This is, you know, your baby that you lost. And I like to tell women that the ones that I speak to, and say you don't have to say you had a miscarriage. You can just say, I lost my baby. which sounds, I think, so much more, I don't know, I don't know what it sounds like. Perhaps it's more validating, but it means if people then don't ask the annoying question, you know, they don't say the things that you hate, like, oh, at least you got pregnant, or oh, you can try again, and the things that no one wants to hear at that point.
Absolutely.
But if you say I'm grieving the loss of my baby, then that comes through a lot as well. So I think owning it, but knowing that everything that they will think and feel is normal, and just part of the grieving process is definitely part of what we do and help.
Absolutely. People. Definitely. And I think it's so important that women allow themselves to experience or, you know, feel these ways without self-criticism and self-doubt. You know, I've looked after women before who've said to me, you know, it's common when one woman is pregnant, a lot of her friends may be pregnant at the same time. It's that stage of life. And it's very hard for a woman who's had a miscarriage to be surrounded by her pregnant friends who are all, you know, showing off their wonderful scans and their baby bumps and having their gender reveals. It's very difficult. And I've had a number of patients, you know, who say, I don't want to go to the baby shower and I don't want to go to the gender reveal. And you don't have to. And that's the truth. You know, you've got to put yourself first sometimes and look after your own emotions and well-being. But I think, you know, there's a lot of expectation that people put on themselves, but I don't think other people actually put those expectations on them. So I always, you know, try to make my patients, absolutely.
Understand.
Definitely. Completely agree. And what about sort of partners, you know, how are they, you know, to best support the women that are going through these things? You know, I think a lot of partners often try to be strong and try to, you know, not allow their emotions to be shown, but how do you advise the partners or the closest support people of those who've gone through the miscarriage to be there for them whilst also allowing themselves to grieve?
Yeah, we definitely recognise and validate partners' grief, which is also a massive part of the process. And so on the website we have a downloadable resource for them. And also when we speak to women, we also talk a lot to them about their partners and how differently they will be grieving. Because it's a different type of grief. And it's very important because, especially if we're talking generally about males, they will feel lost because they can't fix you. And all they want to do is fix the problem. And they can't. So we basically sort of speak to the women about how the partners may be feeling or may be trying to help. And we also have the downloadable resources that they can use. And we have had some couples who speak to our peer support ambassadors together as a couple, and we can have the partner as well speak to an ambassador alone just to get through their grief, because they might be grieving. I mean, there's a spectrum of grief, and theirs is as valid as anyone's. So it's important to acknowledge that.
Absolutely. And for, you know, family members of people who are going through a miscarriage or closest friends, I think I've done a similar talk on later pregnancy loss previously, and stillbirth and you know, infant loss, about how, you know, families and the closest support network can be there to support women and couples going through these things. But for people tonight who are watching, Anna, who say, you know, one of my best friends has recently had a miscarriage, or, you know, it's happened to my sister or my cousin, how can they support those other people going through a miscarriage? Should they be checking in often? Should they be keeping a distance and waiting for people to ask for help? What's the right way to look after someone that you really love who, you know, is going through an early pregnancy loss?
Well, we encourage people just to be there, to listen, and to just be the shoulder to cry on. There's nothing you can say apart from the fact that you're there, and you're there to be with them, and you're there to listen and talk about the baby as well. A lot of people don't feel that they want to bring it up, or they don't want to talk about the baby in case they'll, you know, upset them. And actually a lot of people just want to talk about them and validate their baby and talk about how that they were part of the family. And it's things like that that people don't necessarily realize. You'll often find that people will discover that a lot of friends come out of the woodwork with all their miscarriages or pregnancy losses. That's quite something that's been quite exceptional, actually. I found that too, that that as soon as you talk about yours, other people then open up about theirs, and that's quite important as well. We also have a resource on the website for friends and family that you can download, which is sort of things to say, not what to say, if that makes sense. How they can help, and how, you know, they can just be there for this family. And
Absolutely. Brilliant. Someone's just written something here, and I think it's a really interesting point that I want to bring up with you, Anna. It says, you know, do you think that, you know, giving statistics like saying you're 1 in 4 is actually helpful, or do you think it sort of diminishes what people are going through? And I was actually having a chat with someone today who said that a lot of women going through miscarriage find hearing statistics diminishes their experience of what's happened, whereas a lot of partners actually find it a useful statistic to know. What's your experience of that?
Yes, I found for the women, it just makes you a number. It just makes you a statistic, a percentage. It doesn't validate your loss. It kind of brushes it aside. So, so we don't often say that to anyone. We have that, you know, as a statistic, and we know that, but it's not. It doesn't help. It doesn't help the grieving process. It doesn't help validate your loss. It's not helpful. So, but I do sometimes remind people on peer support calls that they're not alone, and the fact that 282 women a day in Australia are miscarrying. That often makes them feel like they're not alone, that they're in a horrible club, but they're in a club that's supported and with us, and so they feel like they're not. It's not just them, but I think that is more powerful for them. But for the partners, I think it's helpful for them to know the stats and to know how common this is, and it's not, you know, it's not that crazy, and it does happen. And so but again, it's, you know, it depends on each person and how they
and 100%. I think it's summed up really perfectly at the bottom of the screen here. As Melissa writes, every loss is different and personal. It's about you know, treating every woman and couple as an individual scenario, and not grouping everyone who goes through this together, and giving each woman and couple the time they need to work out what's right for them. I think that's absolutely right. So I sort of want to move on to probably what will be the last thing we'll have time to cover tonight, and that is about pregnancy after loss. And this is something that I am very passionate about, and something that I do a lot of. And I'm happy to talk you through sort of how I approach it, but I want to hear it from a non-medical perspective. And from your experience in your role, can you tell us a little bit about how you advise women and couples to approach pregnancy after loss?
Yes, so we have another private Facebook group after the miscarriage support and termination for medical reasons. We then have a preconception group. That is basically a little community that discusses trying again, and even contemplating that whole fear of trying again, and all the issues that come with that. And then as soon as you do get pregnant, we have the next group, which is pregnancy after loss. And that is there for everyone who has seen those two lines and then has a panic, because you're desperately trying to have a baby, yet the fear and anxiety of it happening again goes through the roof. And your mental health is actually so important at this point, but it gets so not, you know, it doesn't get looked after at all, and it's the fear and panic that everyone has. So we do have a Facebook group for that, so that we can help everyone through that. And then we have some help and some resources on the website. But we also have, as a charity, we have live chats on our website that we enable for people who go on the website on Tuesday and Thursday evenings. And that we've actually found that a lot of people want to just talk about the fact that they don't know about trying again, or they just got pregnant and they're really scared, and they just need to chat to someone just to get a bit of validation and a bit of support for that horrendous time of not knowing what's going to happen, and that scary time. So
Definitely.
that's something that we also do a lot of.
Brilliant.
And we also have Circle of Supports, which we've started because of our name. So I don't know if I talked to you about our name, but pink elephants being that also when elephants lose a cub, I suppose. I don't know what it's called. Baby elephant.
Nor do I.
I should know that. But all the elephants then actually stand around in a circle and wait until the mother has grieved and gives her time and space to grieve her loss. And so we have been doing a virtual circle of support because we can't all be together. And every month we do a different topic. And September we just had pregnancy after loss. So we had people talk about their experiences, which is one of our ambassadors actually did have a pregnancy after loss and named her baby Hope, which was beautiful. And so we talk through a lot about how probably the fears and the anxiety that you're going through that we understand. And we also had a fitness person, because we find that's something that people stop doing or are scared of doing because they're pregnant. Definitely. Which is what I did. I completely stopped doing any exercise because I was paranoid. And she talked through a lot of exercises you can still do, and it's healthy and active, why you should continue to be active and that sort of thing. So we try and ease a lot of anxiety through that as well, through all our support. We completely recognize how just scary that time is, and how you're not sorted. You don't, you're not okay until you have that baby. And that's something you can disconnect from your pregnancy because you don't want to connect too much in case you lose it. And that again is another thing that we completely recognize and we validate and we support, and we basically nurture you through that time, because it's just such a horrible time, but it's also exciting, and it's just a weird emotion.
Absolutely. I think there are a couple of things that you've spoken about that I want to sort of touch on briefly. And I think the first of those that I sort of get asked a lot of the time is, well, when's the right time to try again? And there are a lot of people sort of commenting on that here. And the answer is there is no right time to try again, but it's when you feel emotionally ready. Sometimes I say to, women who've had, later miscarriages like yourself, that maybe there's a reason to wait a little bit longer while we investigate what's happened and we can work it all out. But for most women that have had sort of a first trimester miscarriage, it's about when they feel ready to try again. And for some women, it's straight away. Their way to heal is to get pregnant again and to move forward and try and have a baby in their arms in 9 months' time. Whereas for other couples, they don't feel emotionally ready for that, and they need a bit of time to work through their grief before they feel ready to sort of embrace another pregnancy. When pregnant, though, I agree with you. It is such a difficult time for these women and couples, because whilst they want to allow themselves to feel excited, the fear and anxiety that comes with knowing, that they may lose their pregnancy like last time is almost completely overwhelming. And in order to protect themselves from going through that, they try to detach and separate themselves potentially from, getting too excited and attached to the pregnancy. And as you offer great support, I think it's also important for their care providers to make sure that they're giving that support. And for any woman or couple that have been through a pregnancy loss, including any sort of first trimester loss, I always say to them, if you want, from the moment you're pregnant, I'm happy to do a weekly blood test to make sure that your beta HCG is heading in the right direction. Rather than waiting till 8 or 10 weeks for your first scan, I'm very happy to do it in my rooms for you at 6.5 weeks, and we can look at a heartbeat. And if you want weekly scans thereafter to give you that reassurance that things are healthy, then that's what I'm here for. So it's about individualizing care and saying, you tell me what I can do to help you through this very difficult time. And for some women, they say to me, look, Scott, I don't want to look too often because that, engenders a lot of anxiety for me, and I'd rather just look at 6 weeks and maybe again at 10 weeks. And, that's adequate for me. But for some women and couples going through this, it's very, very intensive monitoring right through that first trimester until they're sort of well beyond, in fact, the point where they lost their previous pregnancy, before they can say, we feel comfortable enough now to sort of come under a more sort of routine sort of care regime or protocol. But I think it is very, very important that women and couples who've been through a miscarriage once aren't just told, you know, your chance of this happening again is no higher, so don't worry, we'll give you routine care. It's not about the physical care, it's about the emotional support that these women and couples deserve and need.
Exactly, and that's just as the same as the physical well-being as the, you know, the mental, the emotional and the mental
Absolutely.
well-being.
I couldn't agree more.
Yeah.
Definitely.
I also wanted to add that
yes.
With pregnancy after loss, obviously we also support those going through fertility issues and struggles.
Great, excellent. I was going to ask you that.
Sorry, I dropped the
No,
mic.
all good. Please, good.
But no, as you were talking, I mean, you know, we're talking as though it's easy for everyone to get pregnant again. But that's also why we have that preconception page for everyone going through fertility. And we have a lot of people, again, on live chat and on the peer support calls who book in because they're going through that pain of the IVF and fertility issues. And we have ambassadors who've gone through that as well and know what that's like, and the weight and the loss and that sort of thing. So we acknowledge all types of fertility issues.
That's really wonderful. And because, you know, I saw someone wrote before, it's not so easy for some women and couples who have their miscarriage to then say, right, let's get pregnant this month. You know, they may have used their last embryo and it's another entire cycle of IVF and potentially many cycles. You know, I've got women who come to see me with miscarriages who've had multiple cycles over years of IVF, and this was their, you know, pregnancy that they've been waiting for forever. And when that happens, it's not so simple to just get pregnant again. So again, everyone is different, but it's about validating the experience for each individual person.
And we're there for each story and each journey.
100%. And Anna, can you just tell everyone tonight what a rainbow baby is? Because I think it sort of is applicable here, but I read a lot about rainbow babies, and I think you're perfectly placed to tell us about what a rainbow baby is. Correct.
Yes, so a rainbow baby is named as basically the baby you have after a loss. So it comes after the storm. It comes after the thunder and lightning and horrendous storm you've gone through with a miscarriage. And you get the rainbow at the end. And that is your rainbow baby, which is wonderful. And if you've had a previous baby before a miscarriage, which is what I also had, they're called a sunshine baby.
Brilliant. I haven't heard that one.
There you go.
To say. Great.
You get a sunshine baby. You know, you get the clouds and the storm, and then you get your rainbow baby. So they're beautiful, and we have we've got wonderful partners actually in Love to Dream Swaddles who have rainbow swaddles.
Amazing.
And they donate $5 to us for everyone that's sold.
Fantastic. So absolutely brilliant. Fantastic. So, Anna, I think you have done an exceptional job tonight of making myself included, but everyone sort of listening tonight feel very passionate about this area. And it's something that obviously your personal experience has driven you to become involved with, but you do such a wonderful job with it. But to sort of summarize for everyone, how can they access the help of Pink Elephants? I think we've lost Anna for a second. I'll wait and see if we can get her back. She's gone. Hold on. Let me see if I can re-invite Anna to finish the discussion. Otherwise, I will tell you myself how you can access all the Pink Elephant stuff. Give it another minute. Thanks for your patience, everyone. I think Anna's connection may have ended for the evening, but essentially the work that the Pink Elephants do is absolutely brilliant. You can go to their Instagram page, the link to which I will include this evening, and their website is absolutely brilliant. It's been redone. They're doing a lot of work at the moment around Pregnancy Loss Awareness Month, now that it's October, and they have been so supportive of this discussion tonight, and I highly recommend that in conjunction with seeing your own care provider to help you through this very difficult time potentially, that you also engage the work of an organisation like pink elephant support. And also really important to recognise that a lot of people going through this strongly benefit from the assistance of a perinatal psychologist, and certainly there are a number of perinatal psychologists that I can recommend who I work with who are able to help. Let me see, I think Anna is there. Give me 1 second. Just going to try and find her. Hold on. Apparently her kids were playing with her phone. Let's see, hold on. Try one last time. Doesn't seem to be coming up. One moment, sorry. No, that's okay. But as I say, please, in addition to accessing the care from your doctor or medical team, make sure that you've got the appropriate emotional and psychological support that you need. If anyone has any questions after tonight about miscarriage, if anyone's going through a miscarriage or has been through a miscarriage and wants to know more from me, I'm very happy for people to reach out either via Instagram or to contact my rooms, and I'm certainly happy to provide as much support as possible. As I said, I have a particular interest in caring for women and couples who've been through miscarriage in their subsequent pregnancies, and I'm able to sort of cater to everyone's individual needs by creating a plan that is right for every woman and couple based on their own previous experience. Finally, I realised just before I started this talk that I actually have elephants on my theatre hat, so I feel like it was an appropriate one to be subconsciously wearing tonight. But I thank you all for your time, and feel free to reach out if there's anything that I can help you with at any point. Thanks for joining me tonight.